Dr. Frank Fechner is one of the few surgeons who performs rhinoplasty, or nasal reshaping, through small incisions hidden inside the nose instead of incisions on the outside of the nose. Let's find out more.
Rhinoplasty is cosmetic surgery of the nose, also called nasal reshaping surgery. And it is fair to say that it is the most demanding facial cosmetic procedure we perform. And it is as much a science as it is an art form. And this is due to the very delicate anatomy of the nose. And therefore, one rhinoplasty procedure really never mirrors the next one. Each rhinoplasty procedure has to be specialized and designed for the very particular anatomy of that patient. Most commonly, when we perform a rhinoplasty, patients are concerned with the fact that really the nose is out of proportion with the facial features. The nose tends to be too large for the face. We like to see that nose to match better the overall aesthetics of the face, because it is interesting that an attractive nose is really one that does not draw the observer's attention to it, but rather we would like to look at the attractive features of the face, which are the eyes. There are two basic techniques in rhinoplasty that are used today. There's something called an open rhinoplasty, where outside incisions are made at the base of the nose. And then there's something called an endonasal rhinoplasty, or also called closed rhinoplasty, where all the incisions are hidden inside of the nose. I perform almost all of my procedures, if possible, through the endonasal or closed rhinoplasty approach without outside cuts. And although more challenging to learn, and it certainly has more of a demand on the surgeon's artistic view, because at the end one has to being able to assess the anatomy through the skin of the patient in order to alter it and to improve it. It certainly served very well us and our patients with a quicker recovery and less scarring.
I was very happy with the procedure that I had with Dr. Fechner. I chose him because he mostly worked on just faces, so I figured that you can't be an expert on everything. I'd gone to a few other doctors for consultations, but Dr. Fechner made me feel very relaxed and told me what the procedure would entail, what to expect, and what results I could expect.
Whenever we talk to a patient about their nose and a potential rhinoplasty, we really look at the face altogether, because we cannot forget that we really treat the person and not just the nose. So we always consider other facial aesthetic features, including the chin and sometimes even the neck and jawline.